Good evening, tribe. Hope you're having a great evening. Hey, so I have Brittany here with me today, and we're going to talk about nurses on medical missions. She's going to teach us all she knows. I'm super excited. She's got a great passion for this. If you're tuning in, feel free to enter your questions and I will address them as it's appropriate. You can enter comments and I will read them aloud so that Brittany can see them. But please ask your questions. And I have some of you who have entered questions previously. I'll get those answered. If you're watching on replay, thank you. Feel free to comment. All right. So welcome, Brittany.
Thank you. Hi.
Hi. So we're just going to get started. What exactly did you do previously that drew you to medical missions and pursuing that?
Well, I've been a nurse for 6 years, and I have experience in psych, telemetry, and emergency medicine. So I really was drawn to it, though, even before I started nursing. I've always had a love for travel and really was excited about marrying my two passions of travel and nursing. So that's really what got me started on it from the beginning.
So you have a lot of experience in various areas, and you feel like those all tie in well with your desire to be on medical missions?
Yeah, I was actually on my last mission trip. I was in Greece, helping out at some refugee camps, and I was thinking, oh yeah, I'll use my emergency experience, my telemetry experience, but it was really actually the psychiatric experience that I think really helped me the most, and I was able to really draw from that. So I think, some people might be thinking, oh, I'm not an emergency nurse, or I'm not an ICU nurse, so I can't go do this. But really, I think any specialty you can make a huge difference with, so I thought that was interesting.
Yeah. So where all have you been?
I have been, I went on my first, I'll say, mission trip to Panama. And I say mission trip because I was actually only like 12 or 13 at the time. And I went with like a group of 600 people, and we like face painted and, handed out things to little kids. And it was all fun and cute and everything. But, it was more of like a voluntourism trip, as I like to call it. But I've also been to Kenya, and then the Philippines and Greece was the most recent one. So, and I've done a lot of travel outside of mission trips, so I do have a lot of experience with the planning side of it. So.
Okay, that's great. And so what's been your favorite so far?
Definitely the most impactful for me so far has been Greece. Working in the refugee camps and really getting to know the people. I was in Greece the longest amount of time for any mission trip I've been on. So I really got to know the patients I was working with. I got to know the people that were volunteering there. It was really a great team atmosphere. And, the refugee crisis, it's just, I think for a while it was like the cool thing to do, like to be involved in. And when you get there, it's like, this is not cool. Like, this is so emotionally heavy, and like you hear one story after the next. You hear one story and you're like, oh my goodness, that takes my breath away. This has to be a 1 in a million thing. And then the next person walks in and, their story's worse than the first one. And it's just like, it was just crazy. I didn't think that it was going to impact me as much as it did, but it definitely left a huge impact on my life.
Sure. I'm so thankful that you have the heart for these types of missions. Do you feel like there's a good place for someone to go to their first mission, kind of like a ease into it kind of thing? Is there something good to start with?
I think it really depends on the person. I mean, some people might want to ease into it. Actually, my husband came with me to Kenya, and he had never been out of the country. His longest plane ride was St. Louis to Chicago. And he, it ended up being like over 24 hours of travel just to get there. And with like 17 hours on a plane, and he's 6'4", and his knees are jammed into the seat, and he was not expecting that at all. So I think with some people you might want to ease into it. I was afraid he wasn't ever going to travel with me again after that, but it's really up to what you're comfortable with. If there's something you really want to do and you think you can make a big difference doing it, I would say go for it. But you have to gauge your comfort level.
We have a lot of nursing students interested in medical missions. Do they need to wait until they're actually licensed nurses, or can they go as nursing students?
You can definitely go as a nursing student. I actually went to Kenya as a nursing student. You just have a different role, and you don't go there expecting to do nursing. I mean, there's some things you can do. You can do vitals. You can help with, whatever's delegated to you, really, as far as it's in your scope as a student. So I think
maybe
a good rule of thumb.
Sorry.
I was just going to say, like, a good rule of thumb for me is don't do anything anywhere else that you wouldn't do here for a job,
Sure.
Don't go out of your scope. But
I was thinking maybe functioning as like a CNA where they can help in that realm, right?
Definitely.
Yeah, that's awesome. Okay, good. So is there a good place for a new grad to start? Is this a good place for a new grad to start? Which I think you already kind of answered. Like, you can be a nursing student, you can be a new nurse, you can be an experienced nurse. They can find a place where you can help, right?
Right.
Okay. Let's see. Are there certain skills you'd recommend a person being comfortable with prior to going on a mission?
I could go through all the technical skills that you need, but I think, honestly, the number one thing you need is good assessment skills, because, some places you go, you might be the only team of medical providers that patient sees for a whole year. So, it's a huge responsibility just to be able to catch those things that, the person may not have any other opportunity to go to another healthcare provider. So for me, I think that would be the number one thing. Also, I would say, like, just compassion and emotional toughness as well, because you're going to encounter a lot of things that are really going to push you to your edge, your limit as far as emotional, what you can handle. So just be ready for that as well.
In terms of like the hours that you're putting in, or the patients that you're encountering, when you're saying emotional stress, like, can you elaborate a little bit on that?
Yeah. I think definitely, well, not so much the hours as the patient populations you're working with. Just feeding off of their emotional stress and what they're going through can take a toll on some people. Actually, I think it can take a toll on everybody, but it's just that emotional toughness that you build up over time.
Sure. So what's the process of choosing and being accepted to go on a mission trip?
Well, for me, I like to do it a little bit differently, because I like to plan my trips like independently. And you can either choose to go with a giant, large organization. They'll take care of everything for you, but you're going to pay a few $1,000s to go. And I like to just plan all the details myself and take care of it that way. So for me, like when I went to Greece, it took a good 6 to 8 months for me to plan everything as far as travel, what organization I wanted to, partner up with when I got there. And, I like to find a good deal. So I had to scour for that for a while, as far as the flights and stuff. But as far as being accepted, it's really up to the organization. You have to either apply, like they have an application form, or you just email them and you tell them about your experience. And then it's really kind of almost like a credentialing process for travel nursing, where you tell them, what licenses you have, what experience you have, and then they see if you'll be a good fit for that.
Okay. So when you say that there's a list of organizations, is there certain organizations that are, say, in Kenya that are actively working there? And how do you find out who's working with?
That's where all the long hours of the researching comes in, really. I like to work with like grassroots organizations that are actually on the ground and are there year round, versus
Sure.
like just going with a large organization that's there for 2 weeks out of the year and then they're gone.
Okay.
And just by, there's a few different places online I found throughout the years that I go to look for them, but it's really just searching around and, clinic in Guatemala or wherever you want to go. So.
Sure. Okay, Molly asks, how long does it take to plan a mission? And you previously said 6 months. Do you want to elaborate on that? Give or take? Does it depend if you're going to the mission? Okay, go ahead.
If you're going to go with a large organization and they just say, you give us this amount of money by this time and, buy your plane tickets and then you're there. Like you could plan it really quickly that way, but it's going to cost more. But if you want to do the work of planning it yourself, then I would say give yourself at least 6 months to plan it.
So I've done a little bit of research on medical missions for my own personal use. But so I know that some missions you pay to get out there, and then essentially they house you and feed you, but you're working for free, right?
Right. Mm-hmm.
Okay. And then like Doctors Without Borders, for instance, is actually the only one I know of that actually pays you to go. Mm-hmm. Are there other organizations that also pay you to go?
There are some out there. Another one I know of is called Seed Global Health, and they actually pay you to go to certain countries. I know there's a few African countries, and they will, it's not really a high amount, but I think they have like a student loan repayment or some type of living stipend they pay you. And you're basically in like a teaching position. So you'd be teaching like nursing students in that country, which I think is amazing. So I would recommend that.
That's really neat. So Seed and Doctors Without Borders are both paid mission opportunities, right?
Yes.
And then what are some of your favorite, I don't know if you want to talk about this, but some of your favorite organizations to travel? I guess it depends because you're not traveling with a big organization. You're planning it yourself. Well, so there's probably not the same organization planted in different countries.
Well, for example, the organization I volunteered with in Greece is called Kitranos Healthcare, and they have, they're an actual like organization that's in Greece, like they're on the ground working, 24/7, 365, and they accept volunteers to come in and help them. So you're kind of like passing the torch off to the next person when you leave. And so for them, the only thing I had to pay for was my room and board, basically, while I was there. And then I would do all my own meals and stuff. So that was a charge as well. But so that's just one example.
Okay. So essentially, you're paying for the whole thing. They're not paying for your room and board and meals or anything.
Right. Like they had a volunteer house that I stayed in, but I paid them. It was $10 a night to stay there. So.
Oh, okay. Okay. Let's see. Tiffany asked, can I take my family so we can all volunteer in different aspects?
Yes. And actually I've done that. My husband has come on every trip with me, except for Panama when I was 12. But he's not in the medical field at all, but he's very handy. And so when he comes with me, he does things around the mission site, the clinic. He'll do any type of little construction projects that they have or the heavy lifting or whatever. But, I think there's a lot of ways to be a part of it. And I think a lot of organizations are happy to have families there working together.
What about kids? Is there like an age limit or anything?
it really depends, I think, on the organization and where you're at. I know certain areas wouldn't be as safe as other areas, I would think, but if you're comfortable with it and the organization is, I would say go for it.
Okay. What's the process of training like if you're going on your very first mission trip and you get to a clinic site? There's really no training, right? You're just kind of there.
Minimal, very minimal training. I think the longest training I had was, this is where this is how we do this, 20 minutes, and that was it. So you really have to be ready to jump in and hit the ground running and, just be aware of what's going on around you, pay attention, ask questions, just be willing to help out wherever you're needed.
Okay, good. Let's see. The next question is, what's a typical day look like?
Typical day. So I draw on my Greece experience a lot because it's the most recent one that I've had. So a typical day would have been wake up, eat breakfast, and then we all head out as a team. And we would split up into 2 teams because we had 2 camps we were working at. And we would have a schedule of who was going where, what projects were going on that day. Once we got to the clinic, we would open up. People would start shuffling in. We had usually 2 translators that were there with us to help us with the patients. And we would check them in, basically just like a regular, urgent care type of setting where you check them in and then they go back to the room, they see the nurse or the provider. And really we saw anything from a scrape on the knee to chest pain to pneumonia, weakness. We had to transfer a few people to the hospital. So really you can see anything and everything. And once we closed up the clinic for the day, we would be on call after that. So there would be 2 people on call every night. So you might have to go back in later. And actually I have a really funny story about that. One of my favorite stories from Greece was we were, as a team, going out to dinner one night. And we were down in the city and we got a call and it was just frantic from this security guard at the camp. And he was like, "You need to come right now. There's a woman having a baby." And we were like, "Oh no." So, we rushed to get there and there's like this whole team of us and we're just frantic and we're thinking, "Oh my goodness, we're going to have to deliver a baby."
Yeah. And you have L&D experience?
No. Well, there were a couple of doctors with us that had done it in their residency, but nothing like, we were all freaking out. So we get there and we like run up to the gate and we're asking the guard, "Where's the woman that's in labor?" And he's like, "I don't know. One of the girls just told me, so I called you." So we were running around knocking on doors, asking people where this woman was, and nobody knew what we were talking about. And finally we're like, "Okay, who was this little girl that said this?" And they pointed out who it was and we talked to her and she was like, "Come on, I'll show you." So she took us around the corner and there was a dog with 5 puppies that had just delivered her puppies. And we were just like, "Oh my goodness, we are so happy that it wasn't a person."
Yeah, that's so funny. Like, "Thanks, sweetheart. She safely delivered her puppies."
Yeah.
That's so funny.
Needless to say, you never know what you're going to get.
Yeah, that's great. So you mentioned having doctors on your team. What other medical professionals are you working with? Is it primarily just a team of nurses and doctors?
So it was nurses, doctors, we had some paramedics actually that were there. And then we had administration, so a couple of people that would do like our scheduling. They were kind of like our grounding unit that would tell us where to go when, and they were awesome. And then we also had some people that would come in like once a week. I know we had physical therapy. We had lactation counselors and midwives that would come in. So there were some different programs for them.
Okay, that's great. So did you get, you said you were there for a period of time. Did you get like days off where you had opportunities to travel within that time?
We would get, I believe it was 1 day off a week where we could do
Okay.
whatever we wanted. And my husband, since he went with me, we actually blocked like a week before we started volunteering where we were just traveling around and sightseeing. So you can do that as well. But we did get to see some amazing sights when we were there. So that made it fun as well.
That's great. Whenever we're close out the Q&A, you should share a couple of your favorite photos from your mission trips with us.
Oh yeah, that'd be awesome.
I'd love to see them. Yeah. So what are your top 3 challenges on a medical mission?
Top 3 challenges. I would say the biggest challenge for me actually was, since I had this level 1 trauma experience and working at these giant academic medical centers, I was so used to having everything at my fingertips. I was like, we need to consult this person, we need to do this, we need this supply, and you don't have any of that. And it's so hard when, you're trying to treat a patient and you know what could help them, but you don't have it. And so I think that was the number one thing that was hardest for me. Otherwise, I would say cultural and language barrier was really difficult. And I highly recommend researching the culture that you're going to be working with before you go. The language, I don't think you can really prep for in 6 months very well, but you can learn a few words here and there. And the translators are just golden. They're your lifeline when you're over there. So just take good care of them. And
for sure.
Oh, the third thing. I just can't stress enough how emotional these trips can be. And I know it's kind of hard to understand if you haven't been on one, but you see the pain that these people are in and you just feel helpless. You're doing what you can, but you feel like you should do so much more. And for example, there was this family I got really close to when I was there, and they have twin boys who were 5, who both had the same neurological disorder, and they were nonverbal and wheelchair bound basically. And, as a nurse, I'm just thinking like, they need speech therapy, they need swallow studies, they need, physical therapy. There's so much that could be done for these kids, and it's just heartbreaking when, you don't have those resources. So just being prepared for that is important.
Yeah. I feel like I would want to stick a lot of people in my suitcase.
Yeah.
That would be really, yeah, for sure. Yeah. Is it a high stress environment? It sounds to me like it is, but you may have a different perspective.
It can be. For example, one of the days we were there, at one of the camps, there was a bus of refugees who were being basically shipped to the camp to live until they were, sent elsewhere. And it was probably 40 people on this bus, and they refused to get off the bus. They did not want to be at this camp. They were promised something much better, and they did not want to stay here. And the people who were already in the camp did not want them to come there because, it was limited space already, limited resources. And so they were angry about it. The people on the bus were angry about it. And then there was the government there trying to get the people off the bus. And and then we're in the middle, like trying to, just be helpful, because we had to do medical screenings on every single person that came to the camp. And we couldn't leave until we did all the medical screenings. And so, usually we would get 1 or 2 a day.
You get off the bus.
Yeah, and so usually we'd get 1 or 2 a day, and this day we knew we had to do 40, and it took them about 4 hours to resolve it. And It really wasn't even resolved. Most of the people on the bus just got off and walked off, and there were some pregnant women and children too, and it was stressful.
Yeah, that sounds really stressful. So not so much the medical side of things being stressful, more the
No.
cultural and emotional that
Yeah,
you were saying.
cultural, emotional, and lack of resources for sure.
Yeah, yeah. So how do you decompress? Are there resources available to you through the volunteer missions?
Not that I've encountered. Some may have programs after you return, but really the best thing that I found was just really connecting with the team that you're there with at the time.
Yeah.
And, just really leaning on them for support and, talking, laughing. We would go out to dinner once a week and just decompress as a team. And
Yeah.
I think really that's the best that you can hope for in that situation.
Yeah, absolutely. And what are the characteristics that you feel like makes a nurse successful on a medical mission?
Being flexible, being willing to jump in wherever you're needed, not having any expectations of what you want it to be like, just being willing to be whatever they need, I think is the most important thing.
Yeah, sure. Allie asked, what would be the best field to go into to prepare for medical missions?
It really depends what you want to do. I mean, if you want to go to disaster areas, definitely emergency medicine. If you want to go work in a refugee camp, you can really be just about go into any specialty. I think psych there's a huge need for that all over, and I think that's one that's really overlooked. I mean, I truly believe you can take any nursing specialty and you can make a difference on the mission field. I 100% believe that.
Yeah, and previously, Allie, I don't know if you've been on the whole call, but she specifically said really great assessment skills, right, Brittany?
Yes, that's the most important thing.
Because you're seeing these patients that may only see you for a year or more, and so you want to try and catch anything you can possibly catch. Mm-hmm. So what's your favorite tip or trick being on the mission field? Do you have anything specific?
Tip or trick?
Or tip for planning your mission or anything like that?
I think my big tip is like planning it yourself. I mean, for me, I didn't want to spend thousands and thousands of dollars to go do this. And I mean, I would because it's important to me, but at the same time, I wanted to try to find a way that I could do it and still stay on my budget. And I think by partnering with those grassroots organizations and doing your own research, I think you can do that and you can still have an amazing trip and you can still make a difference. Yeah, for sure.
And what do you feel like is the hardest part? You already said what was the hardest part. We already discussed that. Sorry.
Yeah.
And then what do you love most about going on different missions?
What I love, so before I even had the thought of becoming a nurse, I've always loved to travel. I've always loved different cultures. I was actually an exchange student when I was in high school in Germany. So I begged my parents to let me go and do that. And so I think now just being a nurse and being able to use that as a platform to reach people and to connect with a culture and just experiencing all these different cultures through the setting of my job, what I would do normally, I think is amazing and awesome.
So you have a website, and what exactly about medical missions? What exactly are you trying to foster in that community? What do you do? What is your mission and goal there?
So it's called globalhealthrn.com is my website. And then I have a Facebook group, Global Health RN, as well. And I really want to empower nurses to take the chance on these medical mission trips. And I want to teach them that it can be something that's affordable, because that's the number one thing I hear when I talk to nurses is that, oh, I would really love to, but I can't afford it. I don't have the room in my budget, and I just want to show people that you can do this on a budget, and it doesn't have to be something that, it's either pay my mortgage or go on this mission trip. So, and also just in general, raising awareness about global health issues is another big thing that I want to do.
For sure. And knowing that you can actually be paid to go on some of these mission trips, I think is really important too.
Mm-hmm.
All right, Brittany, if you guys don't have any more questions, we will close out our Q&A with Brittany. Thank you so much for giving us your time. I really, really appreciate it.
Thank you for having me.
Really great. Let's see. Oh, Allie said thank you for answering her question.
Oh, sure.
Thanks
for having me.
Have a happy holiday.
You too.
See ya.
Bye.